Okay, so this first question is about prenatal care as the topic, and what the patient Alice is asking is the patient becomes anxious and asks you, what is wrong? Why do I need anything? Is everything okay right now? At this point in time, I would respond to Alice and say, at this moment, you and your baby are stable. The BPP ultrasound test that we did showed normal, which is equaling 2 for the scoring for each area that was tested. One of the concerns that we have is your blood pressure, because it's gone from your normal of 104/60 and is increased to 139/82. You have gestational diabetes, and a risk factor that comes with this is potential for getting preeclampsia, which is why we want to send you to the L&D triage for further evaluation. And then one of the nursing diagnoses that I was looking at for this would have been risk for preeclampsia due to having gestational diabetes, as evidenced by her high blood pressure that increased so rapidly. We know that with preeclampsia, she needs to get her blood pressure checked twice, at least 4 to 6 hours apart, for it to be considered preeclampsia, even though her number was 139/82. She's not quite there, but she's almost there. She's on the edge. We check the urine for protein and ketones to be safe that may or may not be present. And we also check for edema, whether it's +1, +2, +3, or +4. And another nursing diagnosis would be risk for fetal injury due to gestational diabetes related to the high A1C level. So even though the blood sugar is controlled, the A1C shows that in the past 3 months, the blood glucose was still high, meaning the baby is potentially at risk for being an LGA baby, which could result in shoulder dystocia during the birthing process. An intervention for that would be having to do the McRoberts maneuver with suprapubic pressure to get the baby delivered. And another complication could potentially be that the baby will have hypoglycemia. And in this case, our intervention at birth would be to conduct heel sticks and to monitor the blood glucose level. Immature lungs could also be an issue. We may need to give betamethasone to the mom if preeclampsia does get diagnosed and it becomes to the point that it results in the mom having to deliver the baby early for any reason.